Welcome to the best World Health News in Africa. World Health News hosted by Dr. Yavuz Selim Sılay, physician, entrepreneur, and venture architect from Ntr Tv. I have very interesting news that I would like to share. The first one is about the World Islamic Health Association's Science and Statistics Board has published the 15 threats that predicts will threaten the health in 2020, thanks to Dr. Kasım Sezen. Our second news is about the world faces an air pollution pandemic. People's lives are shortened by an average of nearly 3 years from different sources of air pollution. Our third news is about the lessons learned from addressing myths about Zika and yellow fever outbreaks in Brazil. This is very important. And our fourth news is about the toning down your risk of skin cancer. The social media smarts could make you less susceptible to skin cancer, as new research shows that media literacy skills can help change people's attitudes about what is believed to be the tanned ideal. Our last news is about living longer. Everyone wants to live longer, right? So if you want to live longer, stay in school, study suggests. Okay, let's get to our first news. Ladies and gentlemen, one of the most important and strong institutions known as the World Islamic Health Association, WIHU, their Science and Statistics Board has published 15 threats that it predicts will threaten health in 2020.
This is Tohaid. The unfortunate 10-month-old baby cries for humanity laying by the side of the sea, likely the Syrian baby Aylan Kurdi. This picture shows whom we are talking about. Yes, we are talking about the Rohingya, world's most persecuted community. Our fellow Solban brothers and sisters from various corners of the world have extended their hands of cooperation and assistance for these oppressed Rohingya communities. This time, World Islamic Health Union, WIHU, has come forward to take a stand by their side. Small Kindness Bangladesh, SKB, has managed their Ntr tour programs as the implementation partner. On 11 March 2018, a delegation of WIHU arrived in Bangladesh to observe the current status of Rohingya and also to assist them. The members of the delegations are Mr. Kasim Sezen, Chairman, WIHU, Dr. Muammar Timur Kainak, Mrs. Gulsum Sezen, and Mr. Shafiqul Islam. On 12th March, the distinguished guest visited the Rohingya camps in Ukhia of Cox's Bazar. They visited refugee camps and witnessed the activities of children care home located in Jamtoli area. They played with the refugee kids over there. They took lunch with them. The WIHU delegation later visited 2 medical camps in Hakimpara and Jamtoli area, which are being operated for Rohingya refugees. They also treated some patients in those camps and distributed medicine at free of cost to those patients. The visiting guest also distributed 5 pair of scratches and 5 wheelchairs among the disabled persons in Hakimpara camp. Then, the distinguished guest visited the Jamtoli shelter homes which have been constructed by SKB. They also visited the refugee houses to know their exact situations. The visiting guest also passed an effective time with them. Later on, the guest back to Cox's Bazar Hotel. At night, they participated in a few exchanging programs and had dinner with the health professionals and volunteers who are working in the refugee camps. Significant number of doctors, nurses, medical technicians and volunteers involved were present on the occasion. After that meeting, the guests joined cow slaughtering project for preparing cooked meal for refugees and also visited packaging site for relief distribution. 5 cows were slaughtered over there. On 13th March 2018, they distributed 300 packets of dress pack to the refugees. Each of the packets contains 1 dress pack for male, 1 for female, 1 for a boy, and 1 for a girl. Later, they distributed 200 food packets among the refugees in Ghumdhum 3 camps. 200 families have been benefited directly from this program. Each of the packets is enough for a week of a 10-member family. Later, they also distributed 200 packets of hygiene kits among the refugees, which benefited another 200 families. These kits packets are enough to maintain the cleansing activities for 1 month of a 10-member family. Later, they distributed 512 packets cooked meal among the refugees. Each packet contains 1 kg cooked meal, which is enough for 1 day of a 5-member family. Small Kindness Bangladesh (SKB) arrange all distribution programs in coordination with the local administration under the supervision of Bangladesh Army. Then they went to Chittagong via Dhaka by air. On 14th March 2018, they visited the Medical and Dental Faculty of CIMC and CIDC and attended a seminar on Ethics in Medical Profession, Islamic Perspective, jointly arranged by WIHU and CIMC. Then they went back to Dhaka from Chittagong. At night, they met with some disabled and injured brothers and wanted to know their current situation. Finally, at the closing session, they met the SKB officials in Dhaka and took dinner with them. Muslim Rohingya families are extremely delighted with the presence of this distinguished guest. They express their gratitude to Almighty Allah, receiving these food packets, dress pack, hygiene kits, cooked meal pack and wheelchair. May Almighty Allah accept their visit and bless them so that they can do more for this helpless and oppressed community. Ameen.
Dr. Qasim Sezen, the president of World Islamic Health Union, released a press about the current threats to health in 2020. World Islamic Health Union is a non-governmental organization that brings together the non-governmental organizations operating in the field of health services and humanitarian aid in the entire Islamic world. And this was founded in 2016 in Istanbul by the participation of 110 non-governmental organizations from 65 countries under the leadership of Health Association. The World Islamic Health Association's Science and Statistics Board, which is composed of the most important scientists in the world, has published 15 threats that it predicts will threaten health in 2020. These threats are as follows. Number 1 threat is stress. Number 2, obesity. Number 3, loneliness. Number 4, sedentary life, life without movement. Number 5, resistance to vaccination, being against vaccination. Number 6, substance and technology addiction. Many of you are unfortunately addicted to technology. Number 7, posture disorders, not having the right posture. Number 8, increased antibiotic resistance. Number 9, decrease in nutritional value in foods, which means we are eating fake food, not real food. Number 10, exposure to intense magnetic field. Number 11, air and environmental pollution. Number 12, going over the board with aesthetic concern, and because of that concern, doing wrong things. Number 13, missing health literacy. Number 14, lack of personal hygiene. Number 15, coronavirus, Ebola virus, and fatal infectious diseases. By minimizing these health threats, diseases will be reduced. As a result, the burden of hospitals, health personnel, and the budget spent on health are expected to fall, Dr. Qasim Sezen said. If these threats are not reduced, the health of the Islamic community will deteriorate, similar to the entire human being, resulting in severe labor losses and economic difficulties. Undoubtedly, the formation of healthy communities will strengthen the entire world, including Muslims. Thanks to specialist Qasim Sezen, the president of the World Islamic Health Union, for sharing this very important announcement with Ntr TV. Our second news is about an air pollution pandemic, ladies and gentlemen. What we breathe is the most important thing. And people's lives are shortened by an average of nearly 3 years from different sources of air pollution because we have dirty air. This is based on the European Society of Cardiology. Air pollution is responsible for shortening people's lives worldwide on a scale far greater than wars and other forms of violence, parasitic and insect-borne diseases such as malaria, HIV/AIDS, and smoking, according to a new study. Air pollution is responsible for shortening people's lives tremendously, and actually on a scale far greater than wars and other forms of violence, parasitic and vector-borne diseases such as malaria, HIV/AIDS, smoking, coronavirus, according to a study published in Cardiovascular Research. Professors Jos Lelyveld and Thomas Munsell of the Max Planck Institute for Chemistry and the Department of Cardiology of the Center Mainz, Germany, who led the research, said the findings suggest the world is facing an air pollution pandemic. Using a new method of modeling the effects of various sources of air pollution on death rates, the researchers estimated that globally, air pollution caused an extra 8.8 million premature deaths a year in 2015. This represents an average shortening of life expectancy of nearly 3 years for all persons worldwide. In comparison, tobacco smoking shortens life expectancy by an average of 2.2 years, which is 7.2 million deaths. HIV/AIDS by 0.7 years in 1 million deaths. Diseases like malaria that are carried by parasites or insects such as mosquitoes, ticks, and fleas by 0.6 years, which is 600,000 deaths. And all forms of violence, including deaths in wars, by 0.3 years, which is 530,000 deaths. So the researchers looked at the effect of air pollution on 6 categories of disease: lower respiratory tract infection, chronic obstructive pulmonary disease, lung cancer, heart disease, and cerebrovascular disease leading to stroke, and other non-communicable diseases, which include conditions such as high blood pressure and diabetes. They found that cardiovascular diseases, heart disease, and cerebrovascular disease combined are responsible for the greatest proportion of shortened lives from air pollution. 43%, ladies and gentlemen, of the loss in life expectancy worldwide is because of air pollution. They also found that air pollution had a greater effect on shortening lives in older people, with the exception of deaths in children aged under 5 in low-income countries such as Africa and South Asia. Globally, about 75% of deaths attributed to air pollution occur in people aged over 60 years. This is the first study to show the effects of air pollution on deaths according to age, type of disease, and also its effect on life expectancy at the level of individual countries and regions. Professor Jos Lelyveld did a great job. And basically, he says it is remarkable that both the number of deaths and the loss in life expectancy from air pollution rival the effect of tobacco smoking and are much higher than other causes of death. Air pollution exceeds malaria as a global cause of premature death by a factor of 19. It exceeds violence by a factor of 16, HIV/AIDS by a factor of 9, alcohol by a factor of 45, and drug abuse by a factor of 60. Prof. Munsell said, since the impact of air pollution on public health overall is much larger than expected and is a worldwide phenomenon, we believe their results show there is an air pollution pandemic. The policymakers, the health ministers, and the medical community should be paying much more attention to this, ladies and gentlemen. As Ntr TV, we want to highlight that we should fight with air pollution and smoking wherever possible, because these are all preventable. But over the past decades, much less attention has been paid to air pollution and as well as smoking, especially among cardiologists. So this paper, which I was very intrigued when I reviewed it, shows that human-made air pollution and pollution from natural sources, such as desert dust and wildfire emissions, which cannot be avoided. This shows that about 2/3 of premature deaths are attributable to human-made air pollution, mainly from fossil fuel use, which this goes up to 80% in high-income countries. 5.5 million deaths worldwide a year are potentially actually avoidable. So it is much more important than policymakers and the medical community to realize that air pollution is an important risk factor for heart and blood vessel disease. It should be included as risk factor along with smoking, diabetes, high blood pressure, and cholesterol. in the guidelines of the European Society of Cardiology and the American Heart Association on the prevention of acute and chronic heart syndromes and heart failure. The researchers estimate that if air pollution was reduced by removing fossil fuel emissions, the average life expectancy worldwide would increase by just over a year, and by nearly 2 years if all human-made emissions were removed. However, there are large differences between regions due to the diversity in emissions. In East Asia, which has the highest loss of life expectancy due to avoidable air pollution, 3 of the average of 4 years of lost life expectancy could be prevented by the removal of human-made emissions. When we look in Africa, ladies and gentlemen, where population growth is rapid and pollution from dust predominates, only 0.7 of 3.1 years loss could be prevented. In Europe, there is an average of 2.2 years of lost life expectancy, and 1.7 of which could be prevented. And in North America, there is an average of 1.4 years of lost life expectancy, of which 1.1 could be prevented, mostly by phasing out the fossil fuels. Prost Lelyveld also mentioned that in Africa, air pollution represents a health risk that is comparable to HIV/AIDS and malaria. However, in most of the rest of the world, air pollution is actually a much greater risk compared to Africa. So when they looked at how pollution played a role in several diseases, its effect on cardiovascular disease was by far the largest, and very similar to the effect of smoking. Air pollution causes damage to the blood vessels through increased oxidative stress, which then leads to increases in blood pressure, diabetes, stroke, heart attacks, and heart failure. Overall, the researchers use exposure data from the model that simulates atmospheric chemical processes and the way they interact with land, sea, and chemicals emitted from natural and human-made sources such as energy generation, industrial traffic, and agriculture. They applied these to a new model of global exposure and death rates and to data from the global burden of disease, which can actually estimate the expectancy from different causes of air pollution and compare that to the other causes of premature death for countries and regions around the world. So, ladies and gentlemen, this material has been provided by the European Society of Cardiology. For more detail, you can check the materials through European Society of Cardiology or go to our YouTube channel of Ntr TV or reach out to me directly through my WhatsApp number. Our third news is also very important. There are lessons learned from addressing myths about Zika and yellow fever outbreaks in Brazil. And actually, this information intended to debunk myths may have spillover effects. Thanks to Dartmouth College, we get this information from them. So when disease epidemics and outbreaks occur, conspiracy theories often emerge that compete with information provided by public health officials. A new study finds that information used to counter myths about Zika in Brazil not only failed to reduce misperceptions, but also reduced the accuracy of people's other beliefs about the disease. When disease epidemics and outbreaks occur, conspiracy theories often emerge that compete with the actual right information provided by public health officials. A Dartmouth-led study in Science Advances finds that information used to counter myths about Zika in Brazil not only failed to reduce misperceptions, but also reduce the accuracy of people's other beliefs about the disease. The results provide important context as countries launch public information campaigns about the new coronavirus, COVID-19, including how to protect oneself and prevent the spread of the disease. That's why it is very important to evaluate public health messaging and information campaigns, said the co-author Brendan Nyhan, a professor of government at Dartmouth. Their results indicate that efforts to correct misperceptions about emerging diseases, such as Zika, may not be as effective as they hope. So this study was based on a nationally represented survey conducted in Brazil in 2017, and online survey experiments conducted there in 2017, not long after the 2015-16 Zika epidemic. And in 2018, just after an unusually severe yellow fever outbreak. Using survey data, the team first demonstrated the prevalence of misperceptions among Brazilians about whether Zika can be transmitted through sexual contact, which is true, or casual contact, which is false. The researchers then conducted 3 pre-registered experiments testing the effectiveness of information provided by public health officials to dispel myths about Zika and yellow fever. So these studies in general, which were conducted online among Brazilian adults, show that correct information about Zika not only failed to reduce misperceptions, but also frequently reduced the accuracy of other beliefs people held about the disease. A finding that was replicated in both the 2017 and 18 data. So the researchers found that corrective information about the materials that are provided about Zika, and despite all of these have been given, the exposure of this information did not increase support for public policies aimed at preventing the spread of either disease, nor did it change people's intentions to engage in preventive behaviors. That's why, as you see, the real information is so important, and the authenticity, because you are fighting with the wrong information. That's why you need to check always World Health News to get the authentic information. Ladies and gentlemen, our fourth news is about the risk of skin cancer. I reviewed some studies and I was very interested to see that toning down your risk of skin cancer has been highlighted at the University of South Australia. So some of the social media smarts could make you less susceptible to skin cancer, as new research shows that media literacy skills can help change people's attitude about what is believed to be the tanned ideal. This study has been conducted by the University of South Australia, and the research tested the ability of social media to influence people's perceptions of tanning, and finding that the greater an individual's ability to evaluate the social media posts, and the less likely they were to idolize a golden tan. So the world's first study found that individuals with higher media literacy capabilities were much less likely to embrace or compare themselves to a tanned ideal. Yet the opposite was true for those with fewer media literacy skills. Lead researcher, Dr. John Mingoya, was actually very important in this study, and he says that findings highlight the importance of incorporating media literacy into sun-safe education initiatives. The desire for tanned skin has long been part of the Australian culture, yet despite everything they know about the dangers of tanning and the risk of skin cancer, people are still engaging in unsafe sun behavior in the quest for what they consider a healthy golden glow, Dr. Mingoya says. In Australia, where they are exposed to some of the highest levels of ultraviolet radiation in the world, one of the highest rates of skin cancer in the world as well, the desire for tanned skin is undeniably very dangerous. The challenge is that people are exposed to images of the tanned ideal on social media platforms, Instagram, Facebook, Snapchat, and YouTube, and LinkedIn, and where their perceptions of attractiveness are shaped and reinforced by images from advertisers, influencers, bloggers, and friends, many of which have been artificially enhanced or manipulated. It's this kind of actually everyday organic content that we're trying to combat, so that young adults can more easily identify the pervasive way that social media can influence their knowledge, attitudes, and behaviors. Adding such media literacy skills to the entire world, including Australia's existing and well-developed sun-safe messages and campaigns, will help individuals better manage their responses to media exposure and, importantly, reduce any potentially negative self-comparisons. Skin cancer, ladies and gentlemen, is the most common cancer worldwide, with 2 to 3 million non-melanoma skin cancers and 132,000 melanoma skin cancers occurring each year. In Australia, approximately 2 in 3 Australians will be diagnosed with skin cancer by the time they are 70. So we're talking about 2 of the 3 Australians becoming skin cancer by the age 70, which is really scary. So this study tested the responses of 151 young Australian adults, 61 male and 90 females, aged 18 to 29, after exposure to a series of social media posts that featured either tanned or paler skinned models. The most common skin type in the study was Fitzpatrick's skin type 3, 45%, and people whose skin reacts to the sun by possibly freckling, burning on occasion, and sometimes tanning. Media literacy was assessed using the Media Attitudes Questionnaire, MAQ, a Likert type ranking scale that was adapted to test media literacy in relation to the tanned ideal. The study showed that, on average, participants used social media for close to 3 hours a day, splitting their time between Facebook and YouTube, Instagram and Snapchat. Dr. Mingoya says that social media presents additional barriers to healthy sound behaviors. Increasing people's knowledge of how social media messages are constructed, manipulated, and altered, as well as their capacity to impact cognition and attitudes, will improve awareness and skepticism of content on social media, Dr. Minguaya says. What Dr. Minguaya is looking to do is add a complementary layer to existing sound-safe education, which they hope will lead to a reduced acceptance of what people see relating to tent ideals on social media and consequently better health outcomes. With more than 90% of young adults regularly using social media, it's a space we cannot afford to overlook in the battle to combat skin cancer, ladies and gentlemen. That's why as Ntr TV, we're supporting and we're thanking also Australia, the University of South Australia, for providing this story. Ladies and gentlemen, my last news is about living longer. I know who doesn't want to live longer. So a study which I reviewed from the Yale University in the United States says that if you want to live longer, stay in school. A multi-institution study has attempted to tease out the relative impact of two variables most often linked to life expectancy, race and education, by combining through data about 5,114 black and white individuals in 4 U.S. cities. Life expectancy in the United States has been in decline for the first time in decades, and public health officials have identified a litany of potential causes, including inaccessible health care, rising drug addiction, and rates of mental health disorders and socioeconomic factors. But disentangling these variables and assessing their relative impact has been very difficult. Now, ladies and gentlemen, a multi-institution study led by the Yale School of Medicine and University of Alabama, Birmingham, has attempted to tease out the relative impact of two variables, most often linked to life. Expectancy of the life is very important, right? They looked at the race and the education. And by combining more than 5,000 individuals, both black and white, in 4 United States cities, the lives and deaths among this group of people who were recruited for longevity study approximately 30 years ago, when they were in their early 20s and are now in their mid-50s, shows that the level of education and not race is the best predictor of who will live the longest, researchers reported in the American Journal of Public Health. The individuals were part of the coronary artery disease, artery risk development in young adults, which is CARDIA study. Among 5,114 people followed in the study, 395 had died. These deaths are occurring in working age people, often with children before the age of 60, said Yale's Bita Roy, assistant professor of medicine and epidemiology and corresponding author of this paper. The rates of death among individuals in this group did clearly show racial differences, with approximately 9% of blacks dying at an early age compared to 6% of whites. There were also differences in causes of death by race. For instance, black men were significantly more likely to die by homicide, and white men from HIV/AIDS. The most common causes of death across all groups over time were cardiovascular disease and cancer. But there were also notable differences in rates of death by education level. Approximately 13% of participants with a high school degree or less education died, compared with only approximately 5% of college graduates. Strikingly, note the researchers, when looking at race and education at the same time, differences related to race all but disappeared. So black and white did not matter in the study. 13.5% of black subjects and 13.2% of white subjects with a high school degree or less died during the course, compared to only 5.9% black subjects and 4.3% whites with college degrees had died. To help account for the difference in age-related mortality, researchers used very different measures, like the years of potential life loss, YPLL, calculated as projected life expectancy minus actual age at death. So this measure not only captured the number of deaths, but also how untimely they were, which is also important. For example, someone who dies at age 25 from homicide accrues more YPLL than someone who dies at age 50 from cardiovascular disease. It would take 2 deaths at age 50 to equal the YPLL from a single death at age 25. So even after accounting for the effects of other variables such as income, level of education, was still the best predictor of YPLL. So each educational step obtained led to about 1.37 fewer years of lost life expectancy, the study showed. These findings are powerful, ladies and gentlemen, and they suggest that improving equity in access to and quality of education is something tangible that can help reverse this troubling trend in reduction of life expectancy among middle-aged adults. Ladies and gentlemen, you are coming and watching, and really, I truly appreciate your comments on World Health News. I know this is one of the most viewed shows in health, which is the source of authentic news. And among all those, I want to thank you for choosing Ntr TV. This is your host, Dr. Yavuz Selim Sılay. Take care and all the best. Bye.